So we're here at Mahaska Health today, and I'm once again getting a chance to sit with my friend Arthur. So tell us a little bit about yourself, if you wouldn't mind.
Sure. My name is Arthur Zacharjasz. I'm a board-certified nurse practitioner and Director of Occupational, Employee, and Public Health here at Mahaska Health.
All right, so we're here to talk about the flu shots, as everybody knows them.
Why get vaccinated? Well, flu is a contagious disease. It spreads through the United States every year, basically from October to May. And some people are more susceptible to get very sick than others. These are infants, young children, those 65 and older, pregnant people, and people with certain medical conditions. These are the people with weakened immune systems and are at greatest risk of flu complications. Also, if you've had medical conditions such as heart disease, cancer, diabetes, flu can make it worse. And so it's important to note also that in an average year, thousands of people in the United States die from the flu, and many more are hospitalized. And vaccines are very important. Influenza vaccines very important in preventing those hospitalizations and deaths.
Okay, so I know every year we hear about the different strain of the flu that's going to be circulating. So can we talk a little bit about the flu vaccines and just maybe some more information about the
Sure.
flu vaccines themselves?
Sure. So there are many flu viruses, and they're always changing. And so each year, the flu vaccine that's made to protect against the influenza viruses are made by the vaccine experts. Even when the vaccine doesn't exactly match the flu viruses of that season, it offers protection. So the CDC recommends that everyone 6 months and older get vaccinated every flu season. Influenza vaccine does not cause the flu, and it can be given at the same time as other vaccines.
You mentioned a few folks that have maybe some medical complications, some things that they should be aware of. Would you suggest that maybe somebody come and speak with their healthcare provider before they have that vaccine? Or
Sure.
What's your advice for something like that?
Sure. If you have any medical questions, then it's always important to talk to your primary care provider, your healthcare provider. You can always reach out to our public health department here at Mahaska Health. It's important to note that influenza vaccine can be administered anytime during pregnancy, and that people with minor illnesses, such as a cold, can also be vaccinated. But if you have any specific questions, please reach out to Mahaska Health or contact your primary care provider.
I had the flu shot a few times, and sometimes I didn't walk away feeling so well, but you tell me that that doesn't cause the flu. So what kind of, maybe reactions or some sort of effects will the shot have on folks?
Sure. So common adverse effects, and these are normal effects after vaccination because it's your immune system making a response. So you may feel tired, you may have some soreness at the injection site, you may have a headache, body aches. These are all things that usually go away within a couple days and are completely normal from vaccination.
Okay. So any last thoughts, for folks? We're headed really into the heart of that season. So any last thoughts or advice for folks that are, do I want to get vaccinated really? Those kinds of things.
Reach out to your primary care provider. We're offering influenza vaccines here at the hospital and at the local pharmacies. It's very important for this coming flu season that you're vaccinated to protect not only yourself but also others in the community. And so if you have questions, please contact us here at Mahaska Health.